Hello and welcome to ITP-HAPPY Minds. How are all of you? Hope you all are fine. In our last video, we were discussing about depression and regarding the mental illness. So, in this lecture, we are just going to see that what are the types of depression and what are the factors that affect this type of depression. The first kind of depression that we can talk about is major depressive disorder. Major depressive disorder is a major form of depression in which the episodes of depression are frequent, like on a daily basis or 3 times a week, and the symptoms are very severe, that the person doesn't want to talk to the people. He is going to become totally non-social, he or she, and they are going to just sit in under the closed windows, inside the closed doors, and they don't want to meet people, they don't want to visit people, and they don't want to even work anything for themselves, or they don't want to maintain themselves even. Means the small daily routines of life that are also avoided by such people. And then the second type of depression comes persistent depressive disorder. In this case, the depression is little less severe than the major depressive disorder. In this case, the episodes are less or rare. It may be twice or thrice quarterly, or twice or thrice half yearly, like this. But if this is not being paid attention to, and no medical treatment is being taken, or no therapy or counseling is being taken for this, then this may convert into major depressive disorder. Then the third form comes the seasonal affective disorder. In this case, the depression depends upon the season. It means that if the season, and this one thing I would like to tell on this is that it mainly affects when it is winters or when the sunlight is less. Because when the sunlight is more, or during summers, even if it is humid and very hot, still there are less chances of such type of depression. These types of depressions occur mostly when the sunlight is less during winters. Why? Because though there will be sun during the day and moon is always there at the night, everybody knows. But because when the sunshine is less, then the effect of the moon or effect of the low energy is much more on the mental well-being. And then the fourth type of depressive disorder is peripartum, that is after the female gives birth to a child, and it may be or may not be immediate after a birth. It may be a few weeks or months later after giving birth to a child, due to various type of hormonal changes. And then the fifth type of disorder is bipolar disorder. And this bipolar is a very normal word, and you all must have heard this here or there. Whenever we talk about mental illness, this word is very common. Bipolar disorder refers to that sometimes the person is under depression, he or she is very sad, sits under closed doors, don't talk to people, is not social, and doesn't want to participate in daily routine work. And the second phase of that person is that he or she becomes overactive in every type of work, over talkative, over social. And I mean to say, bipolar itself clears its term that two types of behavior, two types of mindset, two types of changes in mood. It may be active or it may be sad. And then there are certain type of depression which cannot be specified under any such kind of categories, and it may not fit into these 5 types of categories, and it may be significant or not so significant, but there is distress, anxiety and anxiousness inside the person, and that can also be counted under depression and treated in that way. And then comes disruptive mood dysregulation disorder. These are generally found in childhood. in children. You must have seen that children or teenagers, when they come under sudden anger outburst, and they are very irritated in small things, all these comes under disruptive mood disorder, means they are very much moody in that case. And now we will just talk about the potential causes of such kind of depression, because depression we know, but what are the causes of this depression? Why does it happen? Why does it occur? Why does this type of depression occur? So in this case we can say the first thing is the biological factor. Biological factor means if there are imbalances in the brain chemicals or the hormonal fluctuations, then any of these type of depression may occur. Then the second is the psychological factors. Psychological factors means the negative way of thinking and experiencing low self-esteem and a history of trauma or violence. Then the third type of factor which contribute to it is environmental factor. Environmental factor means stressful life events, or the type of family you are getting, or the type of social circle or social support, whether you are getting or you are not getting, social isolation and such type, or your behavior, your moodiness, all these comes under the environmental factors, or what you are getting from outside. Then there is substance abuse, naturally, alcohol misuse, drug misuse, that will again worsen your little bit of